Hi, I'm Dr. Thomas Su of ArtLipo Plastic Surgery, and this is part of our Lipedema series. And today what I want to talk about is how do you choose a lipedema surgeon? Well, when it comes to surgery for lipedema, we're talking about liposuction. And liposuction is a difficult thing to do. It's one of the most difficult types of plastic surgery to not just do, but to do beautifully, because liposuction to me is like sculpting. And I would say that in ArtLipo, we do some of the most beautiful liposuction that you could find anywhere in the entire United States, in the world. We do things to a very significant completion. That's about 80 to 90% removal of the fat, compared to what most other doctors do, which is removing only about 50% of the fat layer. Some doctors like to talk about how many liters of fat they remove, how many inches they remove. But we like to talk about the shape. We like to show you the shape. We like to show you the shape before, where we draw out the shape of your body on your own photographs. We like to show you the results immediately after, right in front of the mirror, so that you can see what the results are before you ever go home. That's the difference between doing things artistically and doing things just to remove fat. I've always told people, in my practice, where we do not just lipedema liposuction, but we do liposuction on all parts of the body. The general principle of choosing a liposuction doctor is to find one that knows how to create shape. How to remove things completely, but how to create shape is more important, because that comes down to doing areas in a very complete fashion, knowing how to blend out, and then doing things in a very smooth manner, which gives you a smooth skin surface. Because as we all know, liposuction does not always turn out beautifully. In fact, as a liposuction doctor, I know this better than most. I see patients all the time that come in and they say, Dr. Su, I went to somebody, I had liposuction last year, I hardly see any results, or I only see a little bit of results. One of the other complaints is, I had this done, but now it's lumpy and bumpy, which is even worse. So that's a doctor that's taken a lot, or just taken it very unevenly and left it in a very irregular fashion. So liposuction has to be treated more like a sculpture. It has to be thought of as a shape that's going to be created, and when it comes down to results that you can really notice, that means removing things to the most significant degree. Taking the fat only 50% just isn't enough in many cases. Taking it 80 to 90% leaves a much more noticeable result. Now, nobody that does liposuction can remove 100% of the fat. If they did, the skin would be laying right up against the muscle, and you'd have what's called an adhesion. That's a scarring down of the skin on top of the muscle. So taking 80 to 90% is just about as complete as you can get, while still leaving a tiny layer of fat behind. And that's what's important. So getting back to the question, how do you pick a doctor to do your lipedema surgery? Well, number one, very, very few doctors have much experience at all in doing the lower extremities. A very difficult area to do. It's a circumferential limb, and it's an area where many patients have a lot thinner layer of fat compared to their tummy or waist. So when you're working in a much thinner area, it's difficult to do it completely and right up to the surface of the skin while still doing it beautifully. That's why many doctors, other board certified plastic surgeons, turn it down and say, no, you can't do it, it's not enough. So what you want is a doctor that has lots of experience. In some of my other videos, I've already talked about how perhaps only 1 or 2% of all plastic surgeons or cosmetic doctors have ever even done liposuction down in the ankle or knee area. Ankle or calf area, I should say. And out of all these doctors that have been there, there's probably not many more than 10 to 12 doctors in the entire United States that has a lot of experience. I'm talking about doing 100 plus more cases of the ankle, knee, calf, and extending up into the thigh areas for lipedema patients. So how do you choose? Well, as with all liposuction, choose the doctor that does it the most beautifully. you also want to make sure that they do it safely. Of course, you don't want to go to somebody that does things in an unsafe manner. But if you know that a doctor has good training experience and has done many, many cases of ankle and calf areas, then choose the doctor that does the best results. How do you know? Well, it's quite simple. Go to a doctor's website and see if they have pictures or videos showing the patients of their before and afters. We take pride in this, and I've always said we do things artistically. I am an artist. I was an artist even before I became a doctor. I have a fine arts degree. What does an artist like to do? An artist likes to show their work. And I always say that doctors that don't show any of their after work, really, you should take that as a red flag, because they don't take pride in what they do. Some doctors only show a few of the results. I know I've been to a number of different websites of doctors that do lipedema surgery, and I see 4 or 5 different patients. I don't see good pictures. I don't see good pictures that you can enlarge and see the difference between the before and after. That tells me something. It tells me those doctors aren't quite as concerned about the cosmetic outcome. Well, we take pride in it. Just visit our website. Take a look at how many before and after pictures we have. Literally, I think 40 or 50 before and afters photographs. I think we have 20 or 30 videos of our ankle patients. Ankle, calves, knee, thigh patients. So this is because of who we are, an artistic nature. So if you're looking for a doctor that can just treat your lipedema, get rid of some of the fat and give you some improvement in symptoms, there's quite a few. If you're looking for a doctor who can get rid of your symptoms and do the most beautiful work, take a look at us. Take a look at our before and after pictures. I think you'll be quite impressed how beautiful the shapes of the legs are. The shape of the leg, a thinner, contoured, toned look does not come naturally. It does not come from any liposuction. It comes from very specific liposuction. It comes from a doctor that is used to treating things. If you watch any other videos, we do high definition arms where we sculpt to the point that you can see the biceps, triceps, and see a celebrity looking arm. We call that celebrity arms. It's because of our skill. And that we can do the same thing with your lipedema in your legs and in your arms. So thank you for watching, and I hope this has helped. Bye-bye.